The Obama administration softening its position on the public insurance option. We're hearing more talk about insurance co-ops. Senior medical correspondent Elizabeth Cohen is here with us. Co-ops. What is a co-op?
Well, Senator Conrad talked a little bit about them in Jim's piece, but let's go into a little bit more details. A co-op, there are a couple of health co-ops out there in the country, most notably Seattle and Minneapolis. They are nonprofit organizations, which is very different from health insurance companies. The patients elect the governing board, again, very different from your basic Aetna, United, etc. And you need to have tens of thousands of members at least to make it work in order to get that purchasing power that you need. Some would say you need hundreds of thousands of people to make it work.
Yeah, but all right, tens of thousands, hundreds of thousands, but we're talking about 46 million people by some estimates who don't have insurance. Does this idea of a co-op get those people covered?
Right, that's a big problem. 46 million uninsured Americans, that's what reform is trying to help. Will co-ops solve that? No. That is according to two folks who run co-ops, one in Seattle and one in Minneapolis, who I was on the phone with earlier. I said, is this going to help? And they said, no, we're not charities. You have to spend money, you have to pay premiums to join our co-ops, and we don't take everyone. We do say no to some people with pre-existing conditions. Now, one of them said, our prices are middle of the road. We're the average price for, our premiums are about what other people's premiums are.
Well, then what's the point?
Well, the health care debate boiling down to a public option versus a co-op, confusing for a lot of people, because as the public option loses support, some key senators say the member-owned nonprofit route is the best alternative. Cooperatives are successful in other sectors, but how would they work, could they work for major health care reform that would have to be nationalized, or should it be nationalized? Joining us now to help break it down is David Hilsenrath. He's a financial reporter for the Washington Post. David, thank you for joining us today.
Good to be with you. Thank you.
Let's just talk money for a second. Yesterday when I spoke to Howard Dean, he said that if we go forward with these co-ops, we'll be dumping $60 billion into the coffers of insurance companies. And that on the surface didn't make any sense to me. So break down the money, and do either of these models really, really make financial sense?
Well, compared to the option of a government-run health plan, the co-ops could be much less of a competitive threat. They could conceivably take away much less business from the private insurance industry. On Capitol Hill, the co-ops have been defined mainly in terms of what they are not. They're not government-run health care. They're supposed to be a more politically palatable alternative. And, Dr. Nancy, there's a big difference. With a government-run health plan, the government could set reimbursement rates for doctors and hospitals. In effect, the government could give healthcare providers a take-it-or-leave-it proposition, and that could lead to much lower premiums and stiffer competition for private insurers. With a co-op, the co-op would have to negotiate rates with doctors and hospitals, and these co-ops could be too small and too weak to command truly favorable rates. And as startups, they might have a difficult time ramping up to compete with established insurers.
The accusation that the White House was essentially making, one that you haven't challenged yet to my knowledge, maybe you will here now. Columbia Hospital Corporation, which you founded, which later became HCA, which made you, from my understanding, incredibly wealthy, was charged with defrauding the government for more than a decade and had to pay a record fine of $1.7 billion. I mean, some would argue, and it would be hard to say they're wrong, that you would be the poster child for everything that's wrong with the greed that has hurt our current health care system.
A mistake in your filing, that was called fraud. Not only did
but 1.7 billion, that's the highest ever paid in the history of the United States that your company ended up having to pay as a result of what you did by defrauding the government.
No one went to jail. I was never accused of anything. Now let's think about it. $1.7 billion sounds like a lot. We had 343 hospitals, 150 surgery centers, over 100,000 patients a day. Now, let's look at the industry. Cleveland Clinic paid big fines. Mayo paid big fines. Yale paid big fines. Now, were they as big? No. But how many hospitals did they have?
But you're the guy who's sitting here telling us that we can't allow the government to do this because it won't work and they might take over or do some things that are wrong. How much more wrong can you be than what you just said? Not only is your company screwed up, and you just admitted to it, but you're saying, and look at all the other companies, they did the same thing.
Do you want a Canadian system?
Some people would answer, yes, they do. As a matter of fact, in Canada, I think they pay 1/2 of what Americans pay for health care. And most of them are proud as pudding of their healthcare system. They write me here every day saying, I can't believe Americans don't like our system. We think it's absolutely fantastic. By the way, let me ask you a question. Your company was accused of something called upcoding. That means they treated patients for something minor, but charged the government, the taxpayers, for something expensive.
Rick,
that was the accusation.
Idea.
Is that true?
Rick, I have no idea. I never did anything with Medicare. I started a company. I bought hospitals. I bought HCA. I bought all the Humana hospitals.
All right. Well, let me ask you this one then. Here's the other accusation. As I was reading about what some people say your company may have been involved in. Your company would go into a region. They would buy up all the hospitals, and then they would shut them all down except for one to make that one hospital very powerful. I mean, I guess that's a good business plan, but is that good for patients?
Absolutely. Now, first off, that didn't happen.
I'm reading a report here, though, from the Post and Courier that says they say your hospitals had consistent dirty facilities. The doctors say the gloves they were asked to use to operate were so cheap they would break, and nurses say they had to treat so many patients they weren't able to handle the demand.
Well, let's look at the numbers. How could I have the lowest cost to a patient? I did. You look at the studies. I had better patient satisfaction than the industry by a long shot, and I had better outcomes because we measured everything. So who probably put that out? No different than what's happening today. Unions put these things out because they want to unionize your hospitals.
You're not saying all of these things are true. I mean, you're copying to the fact that your company had to pay $1.7 billion, which is still the most ever paid in the history of the United States, right?
After I left, the company paid those fines. The company did not pay those fines when I was there.
But hold on.
And I bought.
No. You're playing with the facts, sir. Let me tell you what happened. These charges were charged against your company while you were there, while you were the boss, and it happened over a period of 10 years. Yes, they were paid after you left, but they accused them of happening while you were leading the company. You know that.
And Rick, it covered time frames before I bought those companies, and it covered time frames afterwards.
I guess the point I'm making is, though, look, people are going to look at you as the guy who's telling all these people out there, which is your right as an American, and good for them for wanting to get out there and have a point of view and be passionate about their money and their tax money. But some people are going to look at your record and some of the things that you and I just talked about and say, this is the guy who's leading this charge? Is he the one that we should be listening to? Not exactly a perfect past when it comes to what's right for taxpayers and patients.
Absolutely.